This is just a quick follow-up because I had a 3-month post-op appointment with my surgeon yesterday, and I just wanted to convey how it's going. They did some tests, did a laryngoscopy. It's all healing perfectly, basically. I mean, completely ideally. Where they took the 2 vocal cords and sort of stitched them together, they opened a little bit, as they usually do, but not so much that it's been a problem. If anything, it's been so that I've had an extra good outcome. He was saying that a lot of times any of the lower frequencies are completely cut off. I have not had that problem or that issue because it has opened a little bit, but not so much that it's really prevented it from having the desired effect, where I can speak to you in a frequency that's in the normal feminine range. And I'm actually really happy with the results. He was very impressed overall with my overall range, both how low I can go and how high I can go. Apparently that's not the way it always works out, so I've had an extra good outcome, and it's healing probably better than normal, I would guess. All of those prayers for perfect healing, I guess, really helped. Put out all the good energy and make everything heal in just the right way. I also think just focusing the mind to be in as good a place as possible makes it really much better. So this is only the second time I've seen him after surgery. The first time was a week after, when I had only been healing for a week and everything had healed very well. My vocal cords had healed together quite nicely. And at that point, it was probably about, say, 55% closed. So there was just a small hole remaining open. Apparently some of that has opened up, so now it's not quite so much, but it's still doing fine. It will continue healing, especially the first 3 months are the biggest portion, then the next 3 after that. And I will see him for a year follow-up, a year following the actual date of surgery. I shouldn't have to see him again, honestly, because things are going so well. I am continuing to go to speech pathology, and I will post updates about that. At this point, it really seems like speech pathology and managing resonance, managing diction, managing intonation, managing those things are the most important part remaining, aside from just healing. And barring any unforeseen circumstances, I should not have to get any revisions to the surgery. I mean, that is a possibility. I've known people that have done that because they broke out their stitches. Or you could also have an undesirable result that would have to get either brought up a little bit more or vice versa. But thankfully that has not been the case, and everything's going very smoothly. I think as time goes on, it'll lose more of its gravelly nature. It still sounds a little bit rough around the edges to me. Obviously still having a little more practice to get used to it, so it's all second nature, but I'm really happy with it, and I think it's doing really well. Sometimes I forget that if I want a clear tone, I have to kick it up a few more notes, but that does really help. And the way they, I guess, engineered the change is so that, I mentioned to him my power is mostly like around 300 to 400 hertz, and I guess that's just how it's designed to be. So if I do want to yell effectively, I have to learn how to yell pretty high up, which is not something my subconscious automatically does. It's just like, not what I did when I was a little kid. It's not something that's baked into the firmware, so to say, and it's time to just get used to all of those new habits. So it just happens without thinking again. And that'll happen, but like healing, it will take time. As always, if you have any questions, please leave them in the comments. Check out my other videos where I've been posting regular healing updates, and also I continue to post my speech pathology appointments where I go into a lot of depth as to how I'm doing and how it's getting better and what my stages forward are, which I think might be useful to you if you're thinking about this kind of surgery or just trying to feminize your voice. May you be blessed. May you be filled with unconditional love. May you feel unconditional love from all. May you radiate light and receive the unlimited light that is the universe. Sending you all the love. Aloha.